Good afternoon, and welcome to our insider's look at the new West Park. My name is Doug Earle, and as you may have seen in our recent announcements, I'm the new CEO of the West Park Foundation. So thank you everyone who has reached out to welcome me to the West Park community, and thank you for joining us today. Your interest in our new hospital building that is scheduled to open in late 2023, and your interest in the transformation of our campus over the following 2 years to enable our outdoor space to integrate with our indoor space to support the physical, emotional, and spiritual needs of our patients to get back their lives. We are delighted to give you an advanced look at some of the key clinical and non-clinical areas of the new building that will enhance the care and comfort of our patients. Just a couple of weeks before joining the foundation, I was fortunate to be given a tour inside our new hospital building. I quite frankly was awestruck by what I saw. The contrast with the current facilities is just amazing. West Park will transform patient care with our new building and be a leading example of the future delivery of care in Canada. As many of you will know from your own experience, for our healthcare system to work well, it needs to be strong across the full continuum of care. Hospitals like West Park play a critical role to help our acute care hospitals have the capacity to deliver emergency and surgical services we count on. The COVID pandemic has certainly reinforced this point. In making the choice to join the West Park family, I was attracted to the hospital because of its leadership as the provincial lead for the Ontario long-term ventilation strategy, and serving as a hub, sharing its expertise with other medical facilities and hospitals treating breathing challenges. With COVID, we know thousands of Ontarians went on ventilation machines, and today's respiratory challenges are in every newscast. It puts West Park's expertise at the forefront. I was also impressed with the leadership that is shown by West Park as Canada's largest amputee program, and the key expertise and research into fields like spasticity that it impacts conditions like ALS and MS. But I have also been touched personally. In 2018, my family learned firsthand the importance of a post-acute hospital. When my father had multiple surgeries, he was stuck in an acute hospital for many weeks. It was the access to a rehabilitation hospital that made all the difference in his recovery. It helped him regain his independence. It helped him return home to live safely. In fact, we think his recovery really began when he arrived at rehab. All of us who have needed a rehabilitation hospital for ourselves or for a loved one requiring complex continuing care or long-term care, we know the importance of a hospital like West Park. West Park plays a critical role in ensuring people can access the right kind of care when they need it the most. 2023, just around the corner, will indeed be a historic year for West Park when we open the doors to our new hospital building to patients and families just 12 short months. Don't get too nervous, Shelley, from now. I'm excited to join this foundation at such a transformational time. I feel privileged to have the opportunity to support West Park that is so vital to our healthcare system. I look forward to getting to know you in the coming months and years as we work together on behalf of our patients and the many celebratory milestones that are to come. Unfortunately, Anne-Marie Malek, our president and CEO of West Park Healthcare Centre, she had to send her regrets today, but we are fortunate to have key members of the West Park leadership team available today. And I know we're about to be given a very interesting inside look of our new hospital building. I'm pleased to introduce Shelley Diddy, Vice President of Campus Development and Support Services, Martha Harvey, Director of Operational Readiness, and Shirley Price, Director of Clinical Programs. So over to you, Shelley, Martha, and Shirley.
Thanks very much, Doug. Very happy to be here today to tour everybody through our new hospital. One thing I'm going to point out is that we'll certainly leave time for questions and answers. So if you have any questions along the way during our tour, then if you could please just use the icon down below on your screen for the questions and answers and type them in, and we will definitely get to them towards the end of our presentation. So let me start by first saying that, and I think Doug alluded to this, there have been challenges within our healthcare system and we've all experienced COVID and the pandemic and certainly we're much more aware of these challenges. So our challenge at West Park was basically to design a hospital that, supports our patients in their care journey. And that was really key for us. And we had at very early days identified some design objectives that we wanted to actually, guide us in that development or that design of the building. And, a couple of those were improving the patient, family, and staff experience. That was really key for us in terms of our design, and also looking at how we could improve the quality, patient safety, and patient outcomes ultimately. And certainly for those of you who know the West Park campus, we definitely needed to take advantage of the therapeutic and rehabilitative benefits of nature. We really wanted to bring the outdoors into our new hospital. So our building design facilitates some of these objectives. And, just to give you a kind of a high level overview of how we're configured or how we've actually configured the building is that we've divided the hospital, if you like, into a couple of main parts. So there's an inpatient block and an outpatient block. And those two blocks of the building are joined by a main east-west corridor. And that's really to help simplify navigation through our building. And so today we're going to walk you through some of those spaces and hope you enjoy this little bit of a journey. So if we can begin our tour, that'd be great. Welcome to the new West Park Healthcare Center. Right now you're seeing a rendering of the main lobby. We've just entered through the main doors, or some of you might have come up through the underground parking or from the underground parking through these elevators. So particularly on days like today, inclement weather, I think this will be a real benefit to our patients and families. Just to the left of that will be our resource center. And we're really shifting from the typical library to, one that has digital resources and, availability of journals and research, but that's also to support our patients and families and staff in the information that they need about their care. So just ahead of you, this will be where our information desk will be. Again, we need to have this to be a welcoming environment. There'll be an individual there who can help guide patients and families and visitors through the building. Over here, we have a bit of a seating area. So the seating area will have a very nice fireplace and some cozy seating. And this is for, again, patients and visitors that are waiting for their transportation or their lifts, and they'll be able to look out at the central plaza that will be just ahead of them. We journey down the main corridor that I mentioned. Right now we're coming upon the feature stair. So the feature stair will become a very prominent landmark that will connect the first floor and the second floor. And just at the top of the stair is the auditorium. And if you look beyond that, there are a number of skylights, again, trying to bring natural light into our space. We're just currently walking into the registration area. So the registration area is where our outpatients will come to register either in person at 3 stations that will be located here, or they can actually register through our kiosk, an electronic kiosk, and register before they go up to the outpatient area. Again, just looking at the feature stair from another angle, there will also be a seating area and a children's play area located just beneath the stair. As we move down the corridor, this is our foundation, our donor wall. So again, certainly we appreciate all the various contributions that our donors have made to make this hospital possible. So now we're just venturing a little further down the hall, and in front of you is the gallery. So the gallery is an opportunity for us to showcase our long history, almost 125 years at West Park, of some of the artifacts and the collections and documents that we have retained over the years. So we definitely want to be able to bring those forward and represent our history. Further down the hall is our spiritual care area. This really speaks to the holistic care that we provide at West Park, and it will provide a serene and very calm space in a beautiful oval design area, and representing multi-faiths and that opportunity for all our patients and families. And it will also have access to a spiritual care garden just outside of that area. So as we go down the hallway, and I do keep referring to nature and the outdoors, so you can see by these large windows, again, we're just trying to bring that daylight into our facility. I'm just going to show you here. This is a seating alcove. We have actually created seating alcoves or rest areas every 30 meters throughout the building. Again, recognizing that some of our staff and our patients and families may need to be able to stop and rest and pause before they go on to whatever location they are in the building. That's the recreation therapy just ahead. That is a large multi-purpose area for group programming. There's also a teaching kitchen in that space where patients can learn and practice their skills. And it also is adjacent to a recreation therapy garden. Right ahead of us is the cafe. This will, without a doubt, be a social hub within the building. It's a very bright and inviting space. We can accommodate a variety of seating arrangements. It holds up to approximately 175 seats. And just as we pan out here, you're seeing just a column that will actually encompass our video wall. So we'll have a large video wall where, again, we can host events. We can watch things like the World Cup. If we were built and ready to move in, we could be watching that game tomorrow. So again, we see it as a key social hub. This area here will be more of a lounge area with comfortable seating and a fireplace as part of the cafe. But again, just for, to grab a cup of coffee, have a quieter conversation, we've made that space available. And just as you reach towards the end of this area to those wood doors, that is basically the entry out to the cafe patio. Again, I think we're going to see this as a significant space to be able to eat outdoors, enjoy the outside. It has a canopy which provides some coverage, and you can see the main building just in the background. Those buildings will ultimately be demolished, and that will become our new West Lawn, which will focus on a number of outdoor trails and various garden areas. So quite excited about this entire space. So I think with that, I'm going to hand it over to Martha Harvey, and she can speak to you about the inpatient areas.
Thanks, Shelley. So welcome to the tour of our inpatient unit. Each entrance to the unit will look quite similar, and we'll have the name of the unit, the floor number, and a specific color dedicated to the unit to help with wayfinding. As you enter the unit, as you see now, we'll have an accessible counter area, which will be called our communication center. This will be an area where patients and families will be greeted, and staff will be able to work. At the side of the communication center is a team room for staff to meet, collaborate, and chart, and a quiet room for staff to dictate and make phone calls as well. Here we're moving down the corridor into one of two pods on the unit. And on the left, each inpatient unit will have a dining room for patients if they wish or if they're able to eat meals in the space. It'll be a large open room for dining and other activities such as recreation therapy and unit activities. The room will have a large monitor that can display center-wide events, TV programs, and the like. It'll have a large terrace, which will have beautiful views outside, and the team room will be across the hall and will have windows to assist with patient visibility. Here we're walking down the patient room corridor. At our new hospital, there'll be 80% private rooms and 20% semi-private rooms. You can see the color of the unit is throughout, again, to help with wayfinding. The alcove outside the patient room includes two patient supply cupboards, one cupboard for each patient. so that supplies can be kept close to patient care. It'll help support efficient care and decrease walking for staff. On the wall will be a patient monitor displaying the room number, an image for each room to help with wayfinding, like a flower or a bird, and other pertinent information. As we move into the patient room, there'll be a patient, family, and staff zones, and all rooms will have a hand hygiene sink, as you saw on the left there. The footwall will have a monitor, a wheelchair charging station, and a visitor's chair. And there'll be an overhead lift in every room. The head wall there will include gases, nurse call system, and other components for patient care. And there'll be a large patient wardrobe in every room to store patient belongings. There'll be a patient washroom in every patient room, which will include a sink and vanity, a toilet, and a shower, and it'll be fully accessible for wheelchairs. There'll be large windows for sunlight and views, and a portion of the window will be operable. There'll be several staff support rooms on the other side of the corridor, which includes clean supply rooms, soiled utility rooms, equipment storage rooms, etc. Seating alcoves and distant markers will be on the floor throughout the unit as well. Team substations are near the end of the pod, close to the patient rooms, where nurses and other staff will be working. And this area will also have a medication room and an alcove for equipment. Here we're moving into the semi-private room, and it's the size of 2 patient bedrooms with a wall in between the beds. These semi-private rooms can support patients who would like a roommate, which is a request that we heard from patients that were involved in some of our planning user group meetings. Each space will have the same features as a private bedroom, including a head wall, a foot wall, furniture, lift, cupboard, and their own washroom. The head wall will include an integrated bedside terminal, which is much like an iPad, for the patient to control their lights, blinds, the temperature in the room, have access to Wi-Fi, emails, telephone, education, and the like. The space can easily be converted into 2 patient bedrooms in the future if needed. The rooms will have natural light and beautiful views. Once our existing buildings are demolished, which you see in the screen there, and our therapy trails and activity areas and gardens are created in what we're now calling our West Lawn, patients will be able to watch the activities outside, see the courtyards and the terraces, enjoy the sunrises and the sunsets, and take pleasure in the landscape vistas all the way to the Humber River Ravine. The next area we're going to move into is the shared therapy spaces. Right now, we're coming out of the inpatient unit towards the main corridor. The corridor on the left is to the outpatient block, and the corridor to the right is where the other inpatient unit is located. This shared therapy space includes a large gym for the units on that floor. Therapy is close to the patient, so the patient doesn't have to travel throughout the building to get to their therapy like they do in current state. Most of the gyms are across from the inpatient unit terraces, which will help to bring light into the spaces and again allow for beautiful views. The entrance to the gym is across from the terrace, and you'll see that the gym is a large area which will be filled with stationary bicycles, treadmills, parallel bars, plinths, and other equipment to assist with therapy. The windows at the end of the room is the team room, allowing for full visibility of patients. This is the corridor to the other inpatient unit, and you'll see on the side is the seating alcove to the left to allow for patients to rest if needed. Across from the gym is the patient activity room, which is a light-filled multifunctional space that can be used for several activities such as additional therapy, recreation therapy events, unit events, patient and family events, and meetings, again with lovely views onto the terrace and the West Lawn. So now I will turn the presentation over to Shirley Price for a tour of our outpatient areas.
Thanks, Martha. Thank you, Martha. So if we're starting back at the information desk near the main entrance, we would take a left and proceed past the public seating area towards the outpatient block. Most of our outpatient services are stacked within this zone between the first and the fourth floors of the building. The outpatient elevators provide easy access to patients who may be coming for multiple appointments. This might include visits to our clinics, DI and lab, day programs, prosthetics and orthotics, our sleep laboratory and respiratory diagnostic services, as well as our future hemodialysis center. We're continuing on the first floor to our outpatient rehab services, where the reception desk is positioned to greet patients as they enter. And the waiting area is a large welcoming space with ample seating to accommodate patients waiting for their appointments. There will also be a coat closet for patients to leave their coats and boots if needed, and patient washrooms close by. As we turn down the first corridor to the right of the reception desk, we head towards the main therapy gym. Along this corridor, we have a variety of treatment and consultation rooms, providing quiet and private spaces for patient assessment and treatment, including specialty rooms such as the splinting room, which will be a center-wide resource. As we enter the main therapy gym, you'll see the large team room along the length of the wall to the left. With windows overlooking the gym, the team room offers more than 20 touchdown workspaces for team members, and the room can be divided to accommodate privacy for team meetings. The gym itself is a large open space flooded with natural light through floor-to-ceiling windows along 2 walls. As the gym will be shared by all of our outpatient rehab programs, it'll house exercise and therapy equipment appropriate for a variety of patient populations. Along the length of the windows on the far side, there will be a straight walking track for gait and mobility assessment and training. Therapy equipment will be placed throughout the space and include things like parallel bars, treadmills, exercise bikes, etc. And on the outside of this wall of windows will be our outdoor therapy area, which we'll be able to access directly from the gym. As we continue on from the gym, we enter into some quieter therapy spaces, including a quiet treatment space on the right with additional plinths and modalities such as wax, heat and ice, and ultrasound therapy. And to the left, the OT treatment space, which will include tables and chairs for upper extremity work, an area for a TV monitor and our Wii, and a driving simulator. And next door is the activities of daily living suite, which will include a kitchen and bathroom for patients to practice skills needed for these day-to-day activities. As we exit the treatment space, we enter into our wellness area. This will be a quiet space with 2 rooms for massage therapy, 1 for chiropody, and additional treatment rooms for quiet assessment and treatment. As we turn left through the doors, we move towards our hydrotherapy pool. To the left here is the entrance to a spacious all-gender change room, which will include accessible private changing stalls and day lockers for patients to store their belongings. The pool area will be filled with natural light from the floor to ceiling windows and will be about 5 times the size of our current pool, and will include accessibility features that we're currently lacking. In addition to both stair and ramp access, there will be a chair lift as well as a large H-track ceiling lift that can allow a patient to be transferred into the pool from different areas on the deck. There'll also be 3 levels of depth to accommodate therapy and additional features, including an underwater treadmill, seating, and whirlpool jets. We're very excited about the beautiful space and the programming we're going to be able to offer in this space. As we'll move up to another area in the hospital, on the 3rd floor is located our day program. The day program is a large space programmed to house both our respiratory rehab and maintenance day programs, as well as a new geriatric day program. Our outpatient services are easily located on each floor as you step out of the outpatient elevators. Electronic signage will assist with wayfinding. As we enter the day program, the reception desk is just to the front, is just in front on the right. And as you turn to the left, turn into the corner here, will be a large seating area with day lockers for patients to be able to leave their belongings for the day. Entering into the room, patients would check in before going to therapy. And the first large space on the right side is our multi-purpose room that has been planned with a lot of flexibility for different uses. Furniture will include mobile tables and chairs that can be scattered throughout the room or pushed together to form a large conference table for discussion-based groups. A large monitor will be placed at one end for education as well. As we move into the gym, again, we see a large space with windows floor to ceiling along the end of the wall, the side of the wall, and at the end of the gym. A lot of natural light flooding all of our therapy spaces. Again, our team room is positioned with windows facing the gym for easy view of the patients, and the patients can see the staff when they're in there working. As we move through this space, you'll see we have an alcove with a bay for 3 blood pressure monitoring assessment spaces that could also be used for assessment or quiet space when the patient needs to rest. Therapy equipment, of course, will be spread throughout the gym, including treadmills, practice stairs, stationary bikes, tables and chairs, and plinths again. At the far end, we'll also have a small nourishment area with a fridge for patients who may bring a lunch, as they're going to be here for their therapy for a couple of hours at least. So that's the end of the tour. I hope you've enjoyed seeing a couple of our outpatient spaces. We'd love to show you the rest, but we're all going to have to wait for that. And now I'd like to invite Doug, Shelley, and Martha to join me for the Q&A session.
Great, thank you, Shirley and Shelley and Martha, for what a fantastic tour. We really are seeing the vision coming to life as the construction is underway, and great to see the rendering superimposed over what the spaces we envisaged to look like. So we have some time now for questions. So please, if you do have a question, you can click on the Q&A section at the bottom of your screen and type in your question. I'm going to just read and ask a member of the team to respond. So the first question that we've received is, what are you most excited about in terms of the impact for the new hospital building will have on patient care?
Maybe I'll start. That's a huge question. I'm excited about too many things, and we don't have time for me to go through the list of them, certainly. I think maybe more broadly, the staff at West Park provide great care. And what we hope is that this building will help support that delivery of care as they work with patients. And, I think it's also about creating an environment that motivates and inspires our patients to do the hard work that they have to do to get their lives back, whatever their care journey is. So I think just generally speaking, that's what I'm personally excited about in terms of the new hospital.
Martha?
Thanks, Doug. So as Shelley says, there's lots of really great new spaces, new processes, new technology and equipment. Some of the things I'm really excited about is we will have the 80% private rooms. Right now, many of our patients are crammed into rooms and they don't have a lot of space. We'll also have a dedicated family zone, which will be able to have families come and visit and support patients. Staff will definitely be closer to patient care and patients, and we'll have lots of new technology to support the staff in the care that they're providing to patients.
And Shirley?
I think one of the things I'm most excited about is to see the results in the new building of all the hard work of all the staff and patients who have been so well engaged throughout the whole process in the building. In addition to that, just the spaces are so much larger. I think we all have felt like we've been bursting at the seams for some time. So we're looking forward to being able to work in much bigger spaces and to expand our programs, which is something that we've wanted to do for many years.
So we have a lot more space for our outpatient programs.
Absolutely. The square footage of the outpatient rehab, for example, is about 60% more than what we currently have.
Amazing. Be able to bring the West Park experience to so many more in this time when we really need it. The next question I have is, you sort of teased us a little bit in preparing to manage all this advanced technology in the new hospital building. Could you maybe talk a little bit about the technology and how it'll help our patients and staff?
Sure, I can start. So we will have a number of new technologies to support patients and staff. We're going to have a very robust nurse call system, and that'll have several features to support patient care. We will have handheld communication devices for staff, and that will certainly help to increase communication. We're going to have the integrated bedside terminals that I mentioned during the tour, which is very much like an iPad. So patients will be able to control many aspects of their room. So the temperature of their room, the lighting, the blinds. They'll be able to access Wi-Fi, emails, TV, their phone. So very, very helpful for patients. Staff will also be able to chart on these devices as well. The monitors outside each patient bedroom will have their room number, as I mentioned, the wayfinding image for patients to know which room they belong in when they're coming back to their room. And some things like isolation precautions, fall risks, and other patient information that will be password protected for staff to have access to. In our outpatient area, where patients will be coming in to register for their outpatient appointment, there'll be the registration kiosks. So much like you see in the airport, where you can go up and register for your flight, it'll be the same for registering for your appointment. We'll also have wayfinding kiosks, much like you see in shopping malls, to help people get around within the new hospital. The other thing we're going to have is a real-time location system, or RTLS. And that will help with asset tracking. So if you're trying to find equipment in the new building, it'll help with patient wandering, staff duress, etc. So those are some of the great technologies we'll have available. I don't know if others have anything I've missed.
Great. We have a question from Ted about the capabilities that the new hospital building will have for the prosthetic and orthotic manufacturing.
Maybe I can start. We have I think a very well-known prosthetic and orthotics program here at West Park, and certainly what we're creating in terms of technology, and Martha's shared much of the technology, but the different technology that we're going to be able to incorporate into that space. Again, having more space will be key for any of our patients and visitors who have actually been in our current P&O department. I think that the space, along with the technology and the expertise that we have in place, will definitely support that program going forward in the future.
I have a question around the new hospital and how will it support geriatrics?
I can start with that one. Well, first to say that I'm really happy to see how senior-friendly hospital principles were incorporated into all stages of design and planning throughout the whole project. And then, of course, with the new building, we'll have a new space for a new day program, expansion of and inclusion of outpatient rehab services as well. And incorporate our patient and family resource center as well as a hub for resources for geriatric services.
A question from Jessie Ann around to what extent will the community be able to access the non-patient services on the grounds, or maybe the pool?
I could start again. We're not ready for opening day for sure, but our space is designed to be open to the public as well. But with the pool specifically, we'll be looking to form partnerships with community groups to provide access to our pool. And the outdoor grounds, we're going to have walking trails and exercise stations. And so that'll be open. There's open access for members of the community to come into those spaces.
I'll also add we will have a central plaza at the entrance to our new hospital where we could have community events, farmers markets, hospital events. So it'll be a really nice space. We're also going to have an auditorium, and you can see in the image behind me where it's the Muntz medal. That'll be the auditorium. And then we will have some supporting meeting rooms as well. And we'll be able to use that internally for events, but could also rent that out for others to use as an auditorium or meeting space with breakout rooms as needed as well.
The walking trail on the track on the outside, will that be available to the community as well?
Yes, it will.
And there's an amphitheater, I believe, as I saw in the diagrams. So there could be a lot of activities during the warmer months of the year.
Yeah.
Great. Victoria asked a question. Will there be various food options or vendors in the cafe space?
So we're actually looking for vendors for the cafe space. It's not a large space. It's not quite like your food courts in maybe larger hospitals or malls, but certainly we are looking at that option.
I have a question from Anne around, there was maybe some of the images that we showed around different color panels it appeared that there were different colored panels in the windows. Was that just the manufacturing, or is that an intent?
That's actually an intent. I'm sure we'll get questions about that over time, but you don't see those color panels from the inside. So those are just on the outside. So you wouldn't be looking through a colored window per se. I think, we all recognize the scale of this building is very large, certainly larger than what we, currently occupy. And so that's just a way to try to break up the building, make it a little bit more interesting. Certainly, depending on the weather, sunny, cloudy, it does really provide some interest to the actual design of the exterior of the building. So it was purposely designed in that fashion.
Mm-hmm. I know when I came before I started at the foundation, and I had the opportunity to walk through the current space. Maybe if I could ask you just some of the contrast, because it was so stark walking through the current space, space we have to deliver our care, and what I saw in the new space.
Maybe I'll start, and I'm pretty sure
Shirley.
Martha and Shirley can pipe in, but we have various vintages of buildings. So that's probably the first thing that one notices. It's different style, different era, different paint colors, even flooring, from a finishes perspective. Certainly, and Shirley's already pointed this out in terms of the amount of space or lack of space that we have. I think you can see that when you go on to an inpatient unit, you'll see much equipment in the corridors. Again, we're all trying to navigate around that. So I would say it's going to be the space and the amount of natural light that will come into the space that will be the biggest contrast for most people.
Yeah, I have to agree. Our space is very tight in current state for patients, for families, for staff, and just the new space will help in so many ways to provide care, to receive care. It will be quite transformational.
And with the inpatient floors, the majority of our rooms are ward rooms with four patients to a room. And so having mostly private rooms with private bathrooms is going to be a huge change.
Much. Especially, is there other features in the design to knowing that a pandemic is upon us, and you were planning before it happened? So what are some of those features?
I can start.
Yeah, good.
So we have on each inpatient floor, we will have an airborne isolation room. And what that is a negative pressure room. So if anybody is infectious, they could be put into that room and not have the risk of spreading the infection. We also have a tuberculosis unit that we have planned, and that the whole unit will actually be negative pressure. So each room will be independent as far as its ventilation system, again, reducing the risk of transmission of TB. So we were very considerate of the air within the new building, and it was before COVID that we did the planning, so it will certainly support us moving forward with COVID or other infectious diseases.
I'll just add maybe we're all very conscious now of ventilation. So we are actually a building that will have 100% fresh air coming through the building. So it's not recirculated, it's 100% fresh air coming through the building. So again, a really key component. And we actually identified and designed that prior to COVID. So I think it is our experience with TB. We've had experience with SARS as well. It's really something that we focused on in terms of infection control and how we can minimize or mitigate any transmissions.
Tremendous.
I will also say that we have in our clinic area, we have a tuberculosis clinic that will all be negative pressure rooms as well. So those rooms can be used for any really infectious condition that needs that ventilation. So we've considered it in our inpatient areas and our outpatient areas.
It's amazing how the rich tradition of West Park continues with our tuberculosis. TV follow. I got that word yet. I'm new still. I'll use that card. We have a question about the TTC. Will it be delivering service for our staff and patients?
We definitely hope that will happen. So we have been engaged in discussions with TTC for many, many years. I will say that TTC is actually interested in providing services directly to the campus. From a TTC perspective, it is about ridership and the number of people. So we expect that once we, expand and we move into the new hospital, we will have more people on site. We are also developing our non-hospital development, which will provide, or bring more people again. So we will continue to engage with TTC. I think we all are aware too that the LRT is running, just around or across Eglinton. So certainly there's a lot of opportunity to bring TTC closer to our site, if not on the campus.
I have a question around the long-term care component of West Park, and how is that being planned for in the future?
I'm not sure if we're asking about the long-term care facility that we currently have on site. So that will remain as part of this project. What we have done is we've connected the two buildings. So there is currently an underground tunnel that has been built that connects the long-term care facility with the hospital, the new hospital. So again, that relationship with some of the residents who might come over for some services in the outpatient area or want to visit the cafeteria or the cafe as an example.
Tremendous. And one further question around when is the big transition going to happen? When do we get possession, and what's the current schedule for move-in?
So we don't have exact dates. We expect to have substantial completion, which means a handover of the new hospital to West Park this summer. And there's a lot of work that has to happen after that. It doesn't mean the building is done and ready to go. From a West Park perspective, our staff need to get in there. We need to test the equipment. We need to make sure the equipment and furniture is in place. There's a lot of workflow that we need to do because it'll be new for our staff. And so we want to make sure that we are prepared and ready to safely open up the new building to receive our patients and visitors, and that will happen towards the end of the year, towards the end of November next year. So not that far away.
So I have one final question. We're all very excited about the move-in. I can see the energy building as I've been meeting people. But one last question. So this has been a over $1.2 billion investment by by Ontario, and of course, our support of our donors, helping with the local share that the government's asked us to contribute. How will you measure the impact of the new building on our patients, family, and staff when it's done?
So I could start. That's actually a really good question and really important for hospitals to consider. Hospitals are now measuring outcomes once all the stakeholders have moved in and have worked in the hospital for a period of time. And this is called a post-occupancy evaluation, or a POE. The process of conducting a post-occupancy evaluation actually starts early in the planning of the new building. At West Park, a number of years ago, we formed a committee that included patients and families and staff, physicians, and even Ontario Ministry of Health personnel. And we considered several items that we could study. So what we did was we looked at the gaps in the literature, we looked at pressing issues, and we chose a number of areas that we would study. To date, we've collected all of our pre-occupancy data. And once we move in, we will look at that data and study the different areas. It's about a year after we move in, and see if there's been any changes to the outcomes based on our new space, our new processes, our new technology and new equipment. We hope to actually publish the literature. We've actually published a couple of studies on our pre-occupancy data, and hope to publish as well once we move in, so that we can share some of our information to the external community.
So thank you. Thank you for your time and sharing this sort of insider's look at what is underway here at West Park. It's been very informative, and I hope that everyone's who are viewing have enjoyed the visit. I now like to introduce Janet Griffin, our Vice Chair of the West Park Foundation Board of Directors, to say a few words. Janet?
Thanks very much for that kind introduction, Doug. And thanks very much as well to Shelley, Martha, and Shirley for that fantastic tour and a very informative presentation. I'm more excited than ever to see the facility completed. On behalf of the Foundation Board of Directors, thank you to all of you for joining us today and for your continued commitment to our patients. We wouldn't be here where we are without the support of our community. You are the very foundation of our new hospital. As close as we are to opening our doors, there's still a lot more to do, and your support is important now more than ever, both to ensure our facility is the very best it can be for our patients, physicians, and staff, and support the next phase of our development, the transformation of our grounds. On the site of our current hospital and the Ready buildings, we will create walking paths for exercise and relaxation, community gathering spaces, gardens for visiting and quiet contemplation, and outdoor therapy facilities that will truly set us apart. This is a whole campus transformation that will bring the very best in rehabilitative care to Ontario. I hope you will reach out to Doug or a member of his team to discuss how you can help us provide the best possible finish to our hospital and put the park back into West Park. Thank you again for joining us today. I'd like to end today's presentation by sharing a brief video from a series we created to tell the West Park story. It features Jamoy Anderson, a young man who got his life back after the loss of his leg, finding the strength, courage, and determination to realize, I am not done. I hope you find his story inspirational as we do. And thanks very much for joining us today.
I played sports all my life. But after a severe viral infection, 26 days in a coma, I had to make a decision. Amputate my leg or risk the infection spreading. I just kept asking myself, how would I keep up? How would I play ball? But then I decided I am not done. West Park helped me through it. The rehab got me on my feet and back in the game. I am not done.
West Park Healthcare Center. Get your life back.